What is the knee question that we get asked more than anything else? Are you wondering what is our most popular knee question that pretty much everybody asks when they come in here? Well, we're here to answer that question for you today and give you a little bit more tips on what you can do for your knee pain. We're finishing up our knee pain month here at Physical Therapy for Everybody. We had a great time yesterday with our online webinar and tried to send out some information to people and give them some ideas on things that they can do to help with their knee pain. If you missed it and you're interested, feel free to give us a call or shoot us an email. We could be happy to, once we recorded it, once we get it all up on the interweb, we'd be happy to get that out to you so you can watch it, because there's some really great ideas in there. So I definitely recommend, if you're suffering with knee pain, it's definitely worth, it's about an hour long, but there's a lot of different ideas on things that you can do at home. You can start implementing right away to start dealing with your knee pain. But today we're going to talk about the question that I always get asked anytime if I meet somebody on the street who finds out I'm a PT who has knee pain. They ask me this. When people come in, they ask me this. And that is this: how long is it going to be until this knee pain goes away? Now, that's a pretty good question to want to get answered, and I totally understand. I wish I could answer it very, very simply, because usually I answer that question by asking a bunch of questions. How long has your knee pain been going on? What makes it better? What makes it worse? What have you tried already? Did it make it better? Did it make it worse? Because all of these things, all the answers that you give me to those questions help me to be able to understand more about your knee pain and specifically what's going on. The different tissues in the knee have a different healing time, right? So a meniscus is a different healing time than a ligament, is a different healing time than a tendon, is a different healing time than a muscle. So when we know what the root cause is of your knee pain, I can give you in general a guesstimate of how long it should take to heal. However, there's definitely other factors that come into play. If you have a job that you have to put your knee into a provoking position on a regular basis, is it going to take longer to heal? Yes, it definitely is. And that's the other thing that a lot of people want to ask me is, do I have to stop doing activities, the exercises, the things that I love doing if I come to see you? And I get it. People will actually avoid going to a doctor or a physical therapist because they don't want to be told, I can't run, I can't bike, I can't whatever. And I'll tell you, in all honesty, I very rarely stop people from being able to do their activities. And if we do, I promise it'll be for the shortest amount of time that we possibly can do it. We may have to modify it. Maybe we don't do it every day. Maybe we do some more cross training. Maybe we implement some strengthening techniques. You know, there's all kinds of things that we may put in around that activity to make that activity more tolerable for your body. But I very rarely say, no, you can't do it at all. You just may have to do some other things along with it, because I get it. I have to exercise every morning or I will lose my mind by the end of the day. In fact, sometimes I'll have online meetings in the morning, and so I won't be able to get my exercise in, and by the end of that night I'm just jittery and I just don't feel right because I don't have my exercise in. But you know, it makes the workout the next day like really, really good. So that's always a side benefit there. So I get it that you don't want to have to give up your exercise. I don't want to either. I definitely guarantee you, I do not want to say, no, you can't do that. I might need to. Your body might be telling me that that is the best answer. Your body might be saying, hey, listen, I need you to take a solid 3 weeks off from this particular activity, but you can do this other activity for the next 3 weeks. And I understand that maybe that other activity is not your favorite, but if we know it's only 3 weeks, I mean, right? Maybe we could do it for 3 weeks. If it gives your knee a chance to heal so that you stop having this pain when you're doing the activity that's aggravating it. There's also other ideas. There's other things we can do. There's stretches and exercises and stuff that we can do to support your body to be able to help it potentially work better when you're doing that activity that's really aggravating, and we'll definitely look into that. If we can support, if we can bring a program together that will allow you to continue, then I'm definitely on board with that, as opposed to having to say, no, you can't do that activity for a short period of time. But if I do say no, I promise you it is just going to be for a short period of time, and I promise you I will explain why we're doing that and what the plan is and how we're going to get back to that activity. I remember I had a patient once who came in, and he was a retired gentleman, and he did, well, basically high intensity workouts 6 days a week. And so he was having some knee pain. And I was like, okay, so tell me. And he's like, well, I go to this, CrossFit box 3 days a week. And then I go to the gym the other 3 days a week. And I was like, okay, so that sounds like good cross training. Well, what do you do at the gym? Well, basically at the gym, he was doing the high intensity workouts as well. And so, it's the jumping, the squatting, the lunging, the running, the sprinting, all the things. And I was like, okay, hold on. We need to give your body a little bit of a break, or else this tissue is not going to be able to heal. And he told me when he first came in, he's like, if you tell me I can't work out, then there's no point. There's no point in me coming, because I'm going to continue working out. And I don't want to waste, anybody's time here, because I'm not going to listen to you if you tell me I have to stop. I appreciated the honesty. And I said, well, I can't tell you for sure until we've done the evaluation. So I did the evaluation. I explained to him what his problem was. I explained to him that I needed him to avoid certain activities 3 days a week. So I didn't have a problem with the stuff he was doing at the CrossFit gym. What we decided to do was change what he was doing at the regular gym. By doing that, it gave the tissue enough time to heal that after 3 weeks, he was able to go back to some of his gym program. Now, part of it we just had to transform, because he was overloading the tissues on a regular basis, and they weren't having time to heal. But in the end, he was okay with the program that we came up with. It still had all the elements of what he wanted, and we were able to just transform it, just tweak it a little bit so that it was still safe for his body. And that's definitely what we like to do here at Physical Therapy for everybody. We want to come up with a plan that works for you mentally, but also works for you physically, because we don't want you to continue doing something that's damaging your body, but we totally get the fact that you need to exercise. So if you've been putting off dealing with your knee pain because you're afraid that somebody's going to say you can't do something, or maybe it's actually worse than you think, or maybe you're frustrated because you've been to every provider and you haven't gotten the results that you're looking for, I definitely encourage you to give us a call. Our phone number is 425-658-4944. Happy to have a body chat with you, find out what's going on with your body, learn more about your story, what you've done, what's helped, what we might be a good fit to help your knee get feeling better so you can do all the things you want to do. All right, well, I hope you guys have a great one. Next month we'll have a new topic, so I'll see you next week. Bye.